I am happy to be starting the next session, which is going to be focused on heat illness. So moving away from vibration, heat illness is another area that we are hearing from our industry partners that is really important. I'm very happy to be welcoming our first speaker, Dr. Sandra Dorman. You probably know her as the director at the Center for Research in Occupational Safety and Health. She's also a full professor in the Faculty of Health at Laurentian University. And her doctoral degree was in physiology, specifically pharmacology, and she's translated this background into a really interesting applied research program that is focused on heat stress for a variety of different workers. So I would like to invite Dr. Dorman to take over and talk to us today about heat illness prevention.
Thank you, Allison. Okay, changing my hat now. I'm going to dive in. I'm trying to keep this conversation practical because wearable technology is certainly a big topic of discussion in many concepts in the workplace setting. In fact, the vibration ones this morning that you saw, like, can you actually schedule your work rest break around the vibration, the hands, another great application. But with climate change, we're certainly seeing a lot of questions around heat stress, and with advances in technology, can we combine the two? And is there a place today for wearable technology to prevent heat illness? So let's dive in. My slide's going. Starting off with just a bit of an introduction, so we're all on the same page with heat stress. One of my criticisms, I guess, when I think about heat illness education that's out there, most of the emphasis is put on heat stroke, right? Which is when you've got a sliding scale of heat accumulation in a worker. You can imagine in a hot workplace, whether it's from outdoor exposure or process heat, the body is slowly getting warmer and warmer, right? And there's things that affect that. It can be, you know, how well are you able to dissipate that heat into your environment? How much personal protective equipment are you wearing that's blocking that dissipation? What's the humidity of the environment around you? Because that'll affect the evaporation and the dissipation. But regardless, and I should add too, if you're doing a lot of physical activity, you're generating your own internal heat, right? So there's a lot of things that are creating heat in the system. But when you put fresh human into the job, they come in with a normal body temperature, right? We think of a normal body temperature at 37 degrees as a core. And as you are progressively exposed to heat, your body temperature can rise and rise and rise. And if your body temperature gets up to 40 degrees, that's kind of the definition of a heat stroke happening. And that's where we spend a lot of our education and around, because at that point you can die, right? And even slightly before that point, if you don't die, you're going to have long-lasting effects. And so, of course, it's critical to recognize the signs and symptoms. It's critical to know what to do in an emergency situation around that. And so I'm not saying we don't need that education. We absolutely do. But I think we also need education around what's happening in the lead up to that. Because the emphasis on today's lecture series is occupational illness, right? And an acute heat stroke event, you know, the focus tends to be around the short-term disability and time off. But people that are chronically exposed to hot work are going to have smaller heat illness happening that's also going to potentially accumulate as lifetime occupational illness effects. Okay, so I put this slide up here to sort of show you a little bit of all the areas where heat can have a dramatic effect. And if I think of that creeping up scale of heat, right? The first thing that you see as the temperature goes up is the heart starts working harder. In fact, you can measure just having a person sitting and doing nothing but increasing the temperature of the room, their heart rate will increase at a rate that is in line with the increase in temperature of the environment. As that goes up, then the body's trying to work at getting rid of the extra heat. And so the blood vessels start sending the blood out to the skin to enhance sweating and evaporation, right? And so in the early stages of heat stress, if we're not capturing in the workplace as measures, although workers are feeling it. What's predominantly affected is the muscles and the gastrointestinal system. And so workers will complain about muscle aches and pains after a shift. That means that they've had some level of inflammation happening in their muscles while they were trying to, manage that heat strain. And also workers will often complain of like gastrointestinal cramping. And both of those things are because the heart is redirecting blood away from the muscles that may be working hard and the gut to the skin to enhance evaporation processes, right? If you continue up that ladder of heat strain before you get to heat stroke, you're redirecting blood away from the organs. And on top of the changes in blood, so you're kind of creating an ischemia, right? The heart's beating hard. It's redirecting blood to the skin to get rid of the excess heat, which means it's putting less blood towards all of your organs, like your liver, like your brain, potentially your kidney, right? So that's going to create less oxygen for those organs as well. And so now you're kind of getting an ischemic condition too, which is going to cause inflammation and can start to cause some injury to your kidneys, some injuries to your blood vessels. It can change up your blood clotting cascade. It can cause some injury to your liver. And it also, it's absolutely going to affect your cognitive abilities. In fact, one of the things you may have heard is that if your core temperature gets up to 38 degrees, right? Remember, normal is 37. 38 is what most guidelines are trying to keep you at or under. At that point, your decision-making ability has declined, right? And that's partly because we're getting less oxygen to the brain. And certainly as we continue along this path of more and more heat strain and our body temperature goes up, our heart works even harder, and eventually we can go into full-blown heat exhaustion and then heat stroke. And if that happens, you've absolutely caused some kind of neurological or brain damage. You've also caused some level of kidney damage, and the recovery time from that can be months to years. And part of that we don't always acknowledge too is that most people who have fainted or passed out from heat stroke will develop what's called a heat intolerance, which means they may not be able to return to the work that they were previously doing because they actually will now start developing those symptoms much earlier than they would have before they had the heat stroke event. Okay, so point here is heat illness is very serious. We need to better educate people on it and manage our programs so that we're preventing the early stages of heat illness and we're helping people recover better. Okay, that's why we care about this topic. I also, wanted to just recognize in the heat illness prevention plan, we do have policies in place to try and manage it. We recognize that there's a difference between trying to manage heat illness indoors versus outdoors. And in the indoor scenario, we apply the ACGIH guidelines that have set TLV and action limits for heat stress exposure. So this lecture is not about teaching you all the ins and outs of how to apply the standard. Some of you, many of you will already know it. So just a quick review for those who don't. But basically, the guidelines are looking at a couple of things. First and foremost, they're looking at the temperature within the environment. So remember, this is indoors. So they use a special type of monitor that's called a wet bulb globe temperature. And they get the temperature in degrees Celsius. And then they also look at how hard is the worker working. So we can express that in a couple ways. If you look at this graph here over on the left, they've got wet bulb globe temperature on the y-axis. We've got metabolic rate in watts on the x-axis, and you know, you don't have to know too much about metabolic rate to understand that the higher the number, the harder you're working, right? Because physical work makes your heart beat faster and temperature makes your heart beat faster. You have to take both of those things into consideration to try and set a safe level for people. And so they take those two things and they draw a line on, this is the action limit when you have to do something. This is the maximum that you're supposed to be able to get to. And so if we look, you know, in a sort of practical situation, if the temperature isn't, if the workload is light and the temperature is around here, the 28 is the action limit, the upper limit is 31, they can do 75% of their time on work to 100%. As the physical activity gets higher or as the temperature gets higher, then you have to start increasing your rest cycle to have more rest time. A couple of caveats here. The threshold limit values apply, and the focus here is in the quotations. Nearly all people who are heat acclimatized, adequately hydrated, unmedicated, and healthy workers who are repeatedly exposed without adverse health effects. Like, that is, what percentage of the population of workers can we say are heat acclimatized, adequately hydrated, not on any medication, and are healthy, right? That creates problems. The goal, the guidelines are supposed to prevent workers' core temperatures from rising above 38 degrees Celsius, although we're not measuring core temperature, right? And it was developed using the wet bulb globe temperature threshold, which isn't practical in outside settings. And the gist is that it's an awkward program to apply, and it doesn't work. This study, I think, or this review study summarizes it really nicely for you. If I orientate you to this slide, we've got two different studies on workers, and they subdivided the workers into young workers and older workers. They measured their core temperature while they did their work, and they were applying the ACGIH guidelines. And I've put, and each number represents an individual person, okay? And I put the red line in here to highlight that 38 degrees Celsius, which is where the guidelines are supposed to be keeping the workers at, right? And what you can see is that the majority of workers exceeded 38 degrees. Some of them seriously exceeded 38 degrees. There were differences between how younger workers were affected and older workers were affected. mean, not surprisingly, time comes into play, right? The longer you're exposed. And I mean, that really goes back to that the ACGIH guideline in part was created and tested in a group of young, healthy men. And so to apply that standard to all workers is faulty from the get-go, basically. Okay, and then for outdoors work, most workplaces apply the Humidex plan. I took this off of OCAU's website, who developed this a number of years ago, and I know it's broadly used, and actually I think it's also used for indoor work because it's much more user-friendly than the ACGIH guidelines. And basically, they've got here your Humidex 1 and your Humidex 2, and so if you take the weather data and you get the Humidex and the level is below this Humidex 1, then you can just function as normal. If it's between these two numbers, okay, so 25 to 29 to 32 to 35, then it gives you an action response here, right? And if it's over this number, then you should not be continuing your work, basically. In summary, for the way that we currently manage heat exposure, heat strains occurring in both scenarios, right? Continues to occur. The way it occurs, it's different between different people. Two people can be doing the exact same job in the exact same conditions, and one can develop a heat stroke and the other one won't. So it's not picking up on the individual differences. And also, we know that task and job role also matters. And so it's a little bit tricky to apply the guidelines when, one day you may be doing type A job and another day you might be doing a different type of job. And lastly, I throw back out there climate change because, I mean, there are jobs that have always had heat strain and heat illness as chronic concerns, right? And I would highlight like farming and smeltering, like those are hot jobs. They've always been hot jobs. It's always been a risk. But with climate change, we're seeing that these jobs are becoming even hotter, and we're seeing more levels of people being affected than we used to. But we're also starting to see other jobs where it wasn't so much of a concern before, and now it is becoming a concern. And I actually put teachers down as the example because a lot of schools are not don't have adequate ventilation and air conditioning, and heat illness is becoming a challenge for that group of workers. So it is a pressing discussion. So now I want to jump into monitoring. Let's talk about monitoring. Why do we want to monitor? And I think I've set you up for this slide already. Basically, monitoring is appealing because a worker's body response is modified by lots of different characteristics, right? It's modified by the age of the individual. It's modified by sex. Women tend to be more susceptible to heat accumulation than men, in part because our temperatures runs higher. Or our core temperature, I should say, is set a little bit higher. The presence of disease, the use of medications, your fitness affects you. Whether or not you are regularly exposed to hot conditions, and that's what we call whether or not you're acclimatized. Your hydration state will affect it, but also things like how long is your shift? How long are you being exposed to the temperatures? I mean, even from a day to day, what didn't bother me yesterday might bother me today if I have a cold. Certainly, if I've had previous heat strain, I will be more susceptible, and other things, right? The other reason we're interested in monitoring is that we know that I think I Yeah, no, I didn't. We know that some work cannot have time limits, right? And I use the example of firefighting, but even within a specific job, sometimes you start a job and there is a pressure to complete the job before you walk away from it. And also, some work conditions can fluctuate rapidly, and you might need to respond quickly to them. Another reason is that ideally, because of all of these differences, even within an individual from day to day to day, a good heat stress protection would be preventative, right? It would start to identify that heat accumulation before you started having signs and symptoms. It would also, like, tied to that would be rapid and real time, so you would know as it's happening. And ideally, it wouldn't rely on a secondary monitoring system like another person checking in on you. So if I've convinced you there's a reason to have monitoring, that it can add value to a heat prevention program, then I want to talk about, do we think they can work? And we're going to look at this in two ways. And the first is, you know, what would we monitor? And I guess in terms of, do we think they can work? We have to ask ourselves two things. One is there some kind of human factor that we could monitor that would tell us that a person is having heat strain accumulation? And the other is, can we trust that the device can actually measure that human factor well enough to be reliable, right? And so that gets us to two things. The first is, happily, I guess, the ACGIH guidelines, they were developed according to preventing certain human physiological outcomes. So the first one we've already talked about, right? The guidelines were set up to prevent unacclimatized workers from having their core temperature go above 38 degrees Celsius. And there's a line that says, if you're an acclimatized worker, to prevent your core temperature from going above 38.5 degrees Celsius. So, can we monitor core temperature in people with devices that we currently have? And the answer is yes and no. Do we have devices that accurately measure core temperature? Yes, we do. We have, I would say thoracic and rectal core temperatures are the gold standard. And there's also what's called like a core temperature pill, a gastrointestinal pill, which is a little electronic device that looks like a vitamin pill that you swallow. It goes through your digestive tract. It measures the temperature continuously as it goes through. And because it's got a Bluetooth, it can send that temperature outside of the body and you can record it. However, and thoracic, you actually put the thermometer typically up the person's nose and then down in the esophagus by the airways. And rectal is exactly what it sounds like. You put the thermometer up into the rectum. Obviously, accurate, feasible, no. No. Thoracic is very tricky to do. You're not doing that in the workplace. Rectal, in addition to hygiene issues, is not going to be a preferred method by anybody. The gastrointestinal pill is really, it's not as good as the other two, but it's really practical. But you can't be taking a gastrointestinal pill every day at work. Like those are really only used in research to try and validate other measures. So although the goal is to keep us under or at 38 degrees, we can't use core temperature to get us there. Okay, so what else can we use? Well, a lot of companies are trying to use estimates of core temperature. So we can take tympanic ear measures. You've probably seen that in the doctor's office. Some people have them at home. And tympanic is a decent way to take core temperature if it's done correctly. But again, this isn't a real-time field measure. This might be something that you added on to your system if you were screening or worried. The more predominant way that you see in technology is skin measures that use some kind of algorithm to estimate your core temperature. So let's talk about skin temperatures. The primary problem, I think it's shown nicely in this picture, is that core temperature is the hottest from the inside, right? That's your core temperature, is the red in the middle of this person here. And that's what we're measuring with the gold standard. Skin temperature is always or typically going to be much lower than core temperature because you're cooling off from the inside out. And so if you are taking a temperature on the forehead or on the wrist or anywhere else on the body, it's going to be lower than core temperature. So that's why you need the algorithm to estimate it. But also, I think this picture kind of shows it nicely. And actually, COVID taught us a lot about this too. This is a study we did where we took skin temperature and core temperature on mine workers as they went across various tasks. And you can see the skin temperature, and notice the temperatures are bar on the is a little bit different, right? So the skin temperature at the start of the study was just below 37, where the core temperature actually was creeping up to 37.9, right? So they're not the same. When they went across to do the next two tasks, core temperature and skin temperature both went up relatively quickly. But then when they went to the fourth task, this was actually where they went outside, but it was heavy labor. And so the core temperature was really high. The skin temperature dropped really rapidly because the skin was cooled off so quickly, right? So you can't take a moment to moment skin temp measure to understand core temp measure. What you can do with skin temp though is look at how rapidly the change occurs as a pretty decent predictor of whether the core temperature has gone up. And so skin temperature measures that are looking at change are probably valuable tools as an add-on to a device that's going to be tracking for changes in core temp. Okay, so summary here, core temperature measures in the workplace are not practical. Estimates of core temperature are only as good as the method and the algorithm. And so temperature alone is not going to be sufficient for a tool to predict a heat stroke event. Okay, going back to ACGIH, the guidelines also said that you should not have a sustained presence of a heart rate in beats per minute above 80% of your maximal heart rate. And when you rest, your recovery heart rate at 1 minute after peak physical effort shouldn't exceed 120 beats per minute. Those are pretty specific guidelines, and those can be applied to an individual by calculating or measuring their maximal heart rate. And I'm sure many of you probably have something on your wrist right now that's measuring your heart rate, and technology has come a long way in getting accurate heart rate measures. But again, there are certainly differences between devices. And I would highlight that not all the devices use the same method. Most of your wrist-worn devices, in fact, there may only be one that currently does not measure heart rate by plethysmography, which is basically, it's shining a light. That's why I put this picture in here, to measure the blood vessel as it changes diameter with each heartbeat. That is not as accurate as measuring heartbeat with an electrocardiogram, right? This method shown over here with this monitor is actually measuring the electrical, right, beat of each heartbeat, and that's going to give you a better measure of heart rate if you're using heart rate as a guide, right? So, reminding you, heart rate is tied directly to both accumulating heat temperature, and in fact, heart rate tends to get pretty erratic just before you get really high temperatures and have a heat stroke event. So heart rate can be both a predictor, but also a really good way to enforce a rest schedule, right? We don't want the heart to get so erratic and crazy that you're at 100% of your maximal heart rate for a prolonged period of time. We want to be monitoring your heart rate so that as it goes up and you get above 80% of your max for a period of time, you should be taking a break. And you can be monitoring your heart rate on that break to make sure that it has adequately come down before you go back to work again, right? Okay, so summary for heart measures is field measures of the heart rate are easy, they can be affordable, they can be reliable. Heart rate changes are rapid, and so it is an actionable measure, and heart rate can be self-monitored with alerts. So you don't necessarily have to have the message go to another person. It can be on your wrist, and you can be trained to understand how to do that. The last one around monitoring is symptoms. And, again, so ACGI says symptoms of severe and sudden fatigue, nausea, vertigo, or dizziness should not happen. And there are some good surveys out there that could and should be used as checkpoints for workers. I mean, even just asking them how hot they feel and how quickly they become hot, they'll know. And workers, experienced workers, have a pretty strong sense. I think this is the most inexpensive way to up our game in terms of preventing a heat illness event. So, summary on monitoring with surveys: it can be time consuming, but it is inexpensive and it's relatively easy to implement. It's not rapid. It doesn't capture rapidly changing conditions, and it does require active tracking, but it has promise. I would say in particular for end of day screening. So if you've got a person who's doing, 5 shifts, it might be worthwhile to look at their end of day, how they're feeling, to see how they're feeling across a shift week, and that might change your action plan for how you're monitoring them. So the problem one, can they work? I think yes, they can. I think they are not a standalone system, though. And I say that in part because I don't want anybody to walk away from this thinking that if you buy some kind of monitoring system, you've solved your heat stress plan. No, you need to be developing a heat illness prevention plan. And I think in that plan, for some workplaces, depending on their ability to implement the hierarchy of controls, these tools can be a tool in that plan. And the current problem isn't so much can they work, but that the development hasn't happened enough to really fit the needs of all workplaces with the capability. So problem 2 is, will they work? And this is kind of a different can of worms. So I pulled this up here. Here are a bunch of different wearables. And I've tried to show you a couple things with them. One is that you can be wearing the wearables on all different parts of your body, right? There are some actually that will measure on your head. Some of them will go around the chest. So here's, your Polar, which actually talks to a wristwatch. Here's the Polar here. It's like a plasticky strap that goes around the chest. The Equivital is more of a material that has a little computer sit inside of it, and the electrical is embedded in the material, also worn on the chest. The First Beat is attached by electrocardio stickers, just like when you go to the doctor's office. You might have had something like this to monitor your own heart rate for a clinical setting. Some of them are now being developed to be worn on the arm. Here's one here. And of course, the most popular ones within the community are the wrist-worn ones, right? Okay, so I want you, Toby, can you pull up my first poll question there? I think they're together. I want you to imagine if you were wearing any of those devices, would you be willing to wear a heat stress monitoring device like that would collect your personal data at work? Simple yes or no. And then I also want to know, if you were willing, I guess, or even if you weren't willing, what would be your main concern about wearing a monitoring device? And I didn't put all possible, I just put some of them. But would you be concerned about your data privacy? Would you be concerned about your job security? Are you concerned about discomfort or the hygiene related to the wearables? You know, how do you feel about technology? Do you think it would affect your job performance? And do you think it might introduce a new workplace hazard for yourself? I don't know if we've got enough answers there, Toby. Okay, so I was excited about this first question because I started telling people we should be thinking about wearable technology, particularly for really high risk jobs. Like that picture of the smelter worker, they are at high risk, right? And when I started saying that around 2016, people were very uncomfortable with the idea of wearing a wearable device in the workplace. And your answer to that question, 93% of you would feel yes, and 7% of you would feel no. That's classic. Like we've seen a huge shift in the last 10 years with the comfort level that people have with wearable technology. So that's great. And that's partly why workplaces are looking to implement them, because the shift has changed. But look at your secondary pieces. There's still almost half of you would be concerned about your data privacy. A fifth of you would be concerned that the data might affect your job security. More than half of you are concerned about the discomfort and the hygiene of it. Some of you, 10%, 1 in 10, don't trust the technology or would prefer to rely on their own experiences about or learnings about safety. 1 in 4 think that the device would affect your job performance, and 8% would introduce a new hazard. That's all super fair. And I think I want to harass everybody about this because, and this is where the technology is still falling down, but also where workplaces need to be really careful to choose the right device if they're going to do it, and also to implement a successful program before they're going to do it, right? I mean, any of these devices, this one here, I've worked with some of these. This one takes great data, the First Beat Bodyguard, but to wear an ECG sticker like that every day, all day, it sticks super great, but probably, like, as you keep changing that sticker, it starts to irritate your skin. It's not feasible for every day, all day, because it's just irritating. The Equivital, a lot of people find it very comfortable. So this is the one that looks like a bra. Some people have struggled with it. I would say more so women than men, largely because women are wearing this under a bra. And I don't know if it could be developed to actually replace a bra. That would probably be more practical than trying to have to wear this and a bra. But hygiene-wise, when I use these in participants, I wash them every night for them and make sure that they get a fresh one, right? They get really sweaty. You're going to have to put in some kind of plan for that. Similarly with the armband ones, I'm not sure, like certainly the headbands, people have like felt they get kind of gross. The armbands, does it introduce another hazard in your workplace? Could you be doing your job all day with a new device added on? Okay, I'm running out of time, so I better jump to a few more pieces here. You should know, if you're looking at implementing one of these devices, that previous personal experience certainly matters. If you have worn a device before, you're more likely to wear a new device, and that if your workforce hasn't got experience, you need to spend some time on that. Privacy and security risk is huge. To me, the easiest way around this is actually to not have the data go to the workplace. If you can set up a system where it's an individual monitoring, that's ideal. Anything beyond that, you can't implement the system unless you have articulated a clear and transparent policy around who sees the data. The workers should absolutely be some of the people who see that data and have access to it. There are, norms within any workplace in terms of adapting a new data. Or a new thing? What's the culture of the group, right? That will affect their adaptation. And also, if they're doing a job where they really feel at risk and they see a real value in that device, then they'll adopt it. If they don't see it as a value, they won't. I wouldn't buy any device without field testing it. You need to know if it's going to be comfortable for your workers. You need to know if it's going to be functional in your workplace setting. You also need to be able to ensure that your workers are going to be able to use it easily without compromising their job. In particularly in terms of distractibility or introducing a new hazard, a lot of devices, if the alarm isn't, if the alarm is going off all the time, the worker will unplug it and just be done with it. Or they're going to be distracted by this alarm going off and not, and that may legitimately introduce a new risk into the scenario. So you need to be able to test out, is it distracting? Does it fit your worker well? Is it going to impact their mobility when they're like doing their job? And in that sense, a watch can be a hazard in a certain workplace too if it gets caught on something. So you have to assess all of that for your workers. And lastly, I just want to reiterate, this is a heat illness prevention plan, right? You need to start with applying the hierarchy of controls so that a monitoring tool is part of the plan, but not the only plan. And particularly when I use the example of teachers, I wouldn't be starting with wearable technology for teachers. But if monitoring would be a useful tool in your prevention plan, make sure that you're choosing a device that best suits the needs of your workers and your workplace. And go back, apply an understanding of how the device works and that an external group has validated it for its use. Always field test any device that you're considering. Always make sure that you're going to include an educational and a training program to implement that device. And if data is going to be shared, put in place that transparent policy. I apologize, I'm running over my time here, but I wanted to let you know that CROSH has partnered with OCAL, made possible with support from the Ministry of Labor, Immigration, Training, Skills Development, to further this work and make it more widely available to workplaces and workers. We are in the middle of both updating the heat stress awareness guide, and that guide will include sample work plans of heat illness prevention plans. We're also creating a guidebook that will outline the different ways that devices can measure and estimate core temperature. So all the stuff that I talked about the different ways you measure heart rate and what's more accurate and what's less accurate, we're going to have that in a guidebook for you that you can reference. That should be coming out hopefully within about the next 3 months. And I will stop talking. And if I don't have time for questions, I will type my answers in the Q&A during the next section.
We have one question in our Q&A, and I think you can answer it in a minute.
All right.
Wesley wants to know whether to get a more wearable or acceptable field technology, are you having a trade-off in the accuracy of the data you're getting?
That's a great question. I don't know that I have a straightforward answer. I mean, because different workplaces will have different practicalities, right? So for some workplaces, It might be more practical to put it in a helmet, right? And so on the one hand, you can get some decent ECG measures from the head, but the temp and the temperature measures, if they're applying the good algorithm of change in temperature, not minute to like the minute to minute temperature, because the head can get quite hot, right? You can have an accurate device, but you have to take both of those things into consideration. They can't be looked at alone. I will say, like a wrist watch currently, none of them are going to be as accurate as a chest one for measuring heart rate. But that data is advancing too. And so it a little bit depends on what they're using. And then we still want to have somebody validate the technology and compare it to what we know is the good technology.